Good morning. Welcome to another edition of the Healthy, Wealth, and Wise podcast. I'm Dr. William T. Choctaw, and I will be your host this morning. These podcasts are part of our Leadership Masterclass series, and our purpose each month is to provide you, our listeners, with actionable advice to help you achieve your own personal, professional, and spiritual goals. We consider the health of the mind, body, and spirit paramount, and as a single unit to provide you cumulative strength greater than the individual parts. We are grateful that you've taken some very special time, valuable time out of your routine to journey with us this morning to discuss a subject that we feel is very important. I am your host, Dr. William T. Choctaw, and as I have mentioned before, I am a retired general surgeon who was involved with the surgical practice of medicine for over 50 years. During that time, I did a variety of different types of surgery, but a large percentage, or certainly a significant percentage, of my surgery involved patients with breast cancer. And indeed is what I want to share with you very briefly, some lessons that I have learned from my patients, specifically my breast cancer patients, over these last 50 years. And I specifically want to mention 10 lessons that I have learned from my breast cancer patients. And I do this particularly because this is Breast Cancer Awareness Month, which I think is a very good thing to do, to make all of us aware of the importance of breast cancer and the importance of screening with mammograms, with mammography, and breast self-examination. The first lesson that I've learned from my breast cancer patients was that breast cancer is complicated. Breast cancer is complicated. The second lesson that I've learned is that quality of life is more important than quantity of life. Quality of life is more important than quantity of life. What do I mean by that? My experience, and this is purely anecdotal, that those patients who had breast cancer but had a more positive attitude about it tend to do better. Now, I don't have any tests to prove that. I don't have any study to prove that. That is purely my anecdotal impression. Third lesson is that patient experiences are different even with the same illness. Now, this is similar to lesson number 2, that patients can have the exact same lesion in the exact same location and have basically very, very similar medical issues, but they will still be different. What's my point? My point is that we are individually unique, regardless of what our commonalities may be. We are individually unique. And so one has to treat each patient individually than with a broad brush, if you will. The fourth lesson that I've learned from my breast cancer patients is that none of us, doctors or patients, have absolute control over healthcare events. We don't have control over these things. Many things happen that we expect to happen, but certainly many other things happen that we do not expect to happen. The next lesson, number 5, is to expect the unexpected. That having learned this over the years, I approach every single one of my patients as especially unique, and tried as best as I could to listen and to provide care that was uniquely designed for that particular patient. The next lesson that I've learned from my breast cancer patients is we will never understand why. Frequently, I would have patients say to me, "Why is this happening to me, Dr. Choctaw?" And I would have to honestly say, I do not know. And I think that's one of the, sometimes one of the more frustrating things, or maybe it's a good thing, that we don't know why. It is what it is. We have to deal with it and move forward. The next lesson that I've learned from our breast cancer patients is that doctors help, but God heals. Doctors help, but God heals. The eighth lesson that I've learned from my breast cancer patients is it's okay to hug. It's okay to hug. Now, I was one of those physicians, particularly as a surgeon from the Deep South, originally trained in the Northeast, Connecticut. And we were sort of taught that as a surgeon, you need a certain distance from your patients. And I guess I always did that. And maybe that was part of my personality also. But there were times when hugging was okay. And it was probably therapeutic for the patient and for the physician. The ninth lesson that I learned from my patients that was also okay is that it's okay to cry. This again may seem a little unusual, but we're all human. And I can assure you that when these circumstances occur, I believe good physicians express that humanity. I'm not saying that everybody should cry, but I'm saying that it is important to express that humanity because it is a form of caring for your patients, if it's comfortable for you. And that gets me to lesson number 10. Caring is therapy. Caring is therapy. Now, I know that there are many different things that happen in life, and I'm certainly not one who has all the answers. But at age 76 and with 50 plus years of surgical experience, I have learned some things that I did not know. And so what I've just tried to do is to maybe share some of these things with you, that hopefully on your journey, whatever that journey involves, that whether you're going through something or maybe you can help someone else who's going through something, that you'll remember these lessons that my patients have taught me and maybe use these lessons to help you as you help others. Thank you again for being so kind and gracious with your very precious time. And as I always like to say, be the change that you want to see in the world. Have a wonderful day. God bless.